Now it's time for our Exhibitors Hall. We are proud to welcome Barbara Coppens and Jill Hoegel from Disability Rights New Jersey, Tara Coley from Prism Support Services, Evelyn Santiago from Horizon New Jersey Health, and Derrick Ludvickson-Luna from Blue Light Music Program. The Exhibitors Hall is an opportunity to learn more about these wonderful organizations and work they are doing to support people with intellectual disabilities statewide. Barbara and Jill from Disability Rights New Jersey will get us started, followed by Tara, Evelyn, and Derrick. Okay. I'm waiting.
Okay.
Hey, good morning, Jill.
Good morning. Am I able to share my screen because I have a couple slides?
Yes, you are.
Oh, so
There we go.
sorry. Good.
Okay, everybody can see the slides?
Yes.
Follow on. Great. Hi. Hi, we're really glad to be here this morning. Congratulations to all the award winners. We're gonna talk to you about Disability Rights New Jersey and the work we do there. Yeah, there we go. Okay, how to advance it. So I'm Jill Hoegel. I'm the director of our investigations and monitoring. Barb, introduce herself.
Good morning. I'm Barbara Coppens. I'm the Advocate Assistant for Disability Rights New Jersey. First of all, I want to congratulate for everything you all had done for the year. So let's keep up the good work. It's nice to see everyone.
So I'm gonna talk really briefly about how we came to be and what a protection and advocacy is, and then Barb's gonna tell you about all the things that we do and how the values of your values and self-advocate values incorporate into what we do. So as Disability Rights New Jersey, we are the designated protection and advocacy agency for New Jersey. Every state is mandated to have a protection and advocacy agency. So we are the one for New Jersey. And our mission is to advance the human, civil, and legal rights of people with disabilities who live in New Jersey. So protection and advocacies, they came to be in the 70s when a reporter, Geraldo Rivera, had done an expose on a school in New York called Willowbrook. And his reporting revealed really atrocious abuse and neglect. And so Congress acted and as a result established protection and advocacy agencies, giving us all the abilities and resources to do what we can do to prevent anything like that from happening again. So the protection piece of what we do is proactive stuff. We conduct investigations, we do monitoring, we act on policy, and then our advocacy piece is that we can represent, we have the attorneys who can represent individuals who are having legal matters that fall within our priorities. And so Barb's going to talk to you a little bit more about that. Are you ready to go?
I'm ready, Jill. Thank you.
Take it away.
What we do, we provide, our services provided for free, for anybody with all types of disabilities from 1 on up. And our services we do, we have information referral, implementing legal work. We provide legal, we have the attorneys on staff. We also have advocates on staff, and we have some of them that are investigators, and the monitoring and investigation is what I'm part of. I'm on Jill's team. We go, like as Jill says, we go out and we monitor the developmental centers. We go to nursing homes. We cover the whole state. So that's what we do. Outreach and training, which I love doing. I love doing outreaches. We do a lot of outreaches and we have a lot coming up. So when we go out and outreach, we educate, we talk to them about what our services are, about about our agency, because we have a lot that don't know who we are. And that's why we want to get out to more places to get the word out about our agency, what we do and what we all about out there when we do outreaches, and also training. So we do a lot of training out there too. Public policy. Public policy, we have a director of the public policy, and we have an assistant director of who's the assistant to the public policy director. We do a lot of that to go out, and we meet with the we go to meet with the legislators to talk about what we need, what concerns about for people with disabilities. That's what we do. So we do a lot of that now, so which is good. And next slide, Jill, please. Goals and priorities. Our goals and priorities are abuse and neglect, discrimination, community-based service is what we're working on. And that's what I've been working on that too, because we want to get people off limit the waiting list and get them out, placed out in the community. And now healthcare and decision-making, that's what we do. We work on that. We've been doing a lot of webinars on that, a lot of town halls we've been doing. And because we want to see people with disabilities, and I know other self-advocates could be their own guardian. That's what we like to see, because that would be good for them to be their own guardian, to make their own decisions of making their own choices, decide where they want to live, where they want to work, and all that. That's what we like to see. And children, we have a children's team now. So we have the attorneys that are doing children's team. So that's part of the community inclusion team. So they work with the children. They do like from the youngest on up to 21. That's the youngsters. So we work with children also. Assistive technology, we do assistive technology to go out and demonstrate all the different equipment that people that can't read or see or hear. So we go out and do a lot of that, to do a lot of the demonstrations. And we have the Abilities Expo coming up soon, so we'll be doing that. There'll be 2 other people who's on that team will be out there to do a lot of the demonstrations of the equipment, like a talking alarm clock. Of course, you know, we have people, stuff like things like that, you know, so that's what they do. And employment, we have employment team that works on of getting people out that needs help, that's getting work, or they have a problem on their job site, or and we have advocates, and we're in the processing of having a new attorney will be coming on board to be on that team. So they're like, I think right now there are 3 people. There's a managing of attorney that's in charge of that team on the employment team, so which is good. And outreach training, as I had mentioned about, that's one of our goals and priorities. And we're working on, but there will be more to come to do focus groups and to talk about our priorities, how we can so we can have your feedback and how well we're doing, how can we improve our services and all that, because I think it's a good idea that we need to hear from the self-advocates and other people with disabilities about how we can improve more, how we're doing, or what needs to be done. You know, that's what we're going to be working on. So there will be more to come. So because I think that'd be a good idea that we need to meet with the self-advocates and have a focus groups to do that. So that's what we want to do. So next slide, please. Oh, yes. This is my favorite. And Jill knows that. Self-advocacy means advocating for ourselves and standing up for our rights should be our rights. And our right to self-determination. And it is also a civil rights movement that represents individuals of all races, colors, and religions who have been elected and abused and integrated and misunderstood for most of history. So that's one of what self-advocacy is. We gotta make sure that we have all people with all different races, and so we can't, we should include them. Beliefs and values of self-advocacy. Being a person first, yes. Making our own decision, believing in my value as a person, having other people believe in you as a person. That's what self-advocacy means also. Self-advocacy means also standing up for your rights to get what you need. I want to say, for an example, the other day, if anyone have any questions, let me get into what I was getting ready to say first before we get into any questions. The other day on Zoom with Bob Titus and myself and a couple of other people from the DD Council, we met with Senator Paul Salio, who's the chair of the Senate of the Budget Committee for the state. And we met with him and we talked about the budget, that what should we keep in the budget, what's important that we need in the budget and all that. So I spoke up about the home community-based services, the DSPs, and having housing, because we want to get people out in the community and limit the waiting list and all that. So so that was a nice meeting, was very successful, and I was glad I was able to participate in that meeting, because I wanted to participate because I know Senator Paul Solo. He's the chair of the Budget Committee for the state. He's the Senate. So
thanks, Barb. And I know that we're time limited, so as far as questions go, I'll defer to the meeting organizers. I'm happy to we can share our contact information if anyone wants to reach out to us after the fact with questions about what we do or how we can help.
Thank you, Jill and Barb. We are running a little bit ahead of schedule. So we have an extra 5 minutes if you guys would like to take questions at this time.
Sure, I like to take questions.
Okay, great. We will check the participants list and see if anybody has a question for Barb and Jill. And again, we ask that the questions are more general about the services and supports that Disability Rights New Jersey provides, instead of a personal question about a personal legal issue. Does anybody have questions about
You can reach out to
DRNJ?
us individually if you have a question like that, sure.
Yes, exactly. So it looks like
Barb, I think you summed up everything. I just want to say thanks for all your summing up.
Hi, good morning, everyone. Thank you so much for having us this morning. First of all, I just wanted to congratulate all of the recipients, the award recipients, well deserved. We truly appreciate all that, all that you do. And we also appreciate you including us and being a part of such a wonderful event. Thank you so much. I'm going to share my screen if that's okay.
Fine.
Okay. I'm going to talk to you a little bit about New Jersey Family Care for those of you who don't know. Can everybody see that screen? Yes? Okay, perfect. And you can still hear me, right? Perfect.
yes.
Okay, so New Jersey Family Care is one of the public healthcare coverage programs which provides free or low cost to quality healthcare for adults and children. Okay. The reason why I'm bringing this slide up is because I just wanted everyone to understand the difference between what our responsibility is versus the County Board of Social Services and New Jersey Family Care. So when someone applies for New Jersey Family Care, a lot of people know it as Medicaid. Our responsibility as a HMO, and for those of you that do not know what an HMO is, it's the health maintenance organization, which means we are responsible to maintain your health, to keep you healthy, right? We help you find providers. We help you get your prescriptions when you need it. We help you with if you need to find a hospital, or if you need to find out if there's benefits covered. What benefits are covered. We help with all of that. If you need to get a procedure done and for some reason the authorization isn't going through, that would be our responsibility. When we assist those with applying for New Jersey Family Care or Medicaid, we go online on our laptops. We help right over the phone. We ask all the questions needed in order for the application to process, and then it goes over to either the county or the state. And normally we find out right towards the end of the application. Right. And so it goes to the EDA agency, which is the one that makes the determination of eligibility. That would be their responsibility. So that would be the state or the county Board of Social Services. They're the ones that would make the determination if you are eligible for the coverage or not. We kind of know on a ballpark figure income wise, but we always tell everyone, you know what, let's just do the application. Let's get it to where it needs to go and let them be the ones to make that determination. Okay. And then if for some strange reason, you're not eligible, then what we'll do is we'll look for other ways to help get you connected to get the care that you need. Okay. So if for any chance you receive your HMO card and there's a misspelling in your name, or the date of birth is wrong, or you moved and you need to change your address, very, very important for you to know that you need to contact the County Board of Social Services or New Jersey Family Care to let them know of these changes so that they can make the change. Once those changes are made, it'll come down to us electronically, automatically you'll populate in our system. Okay. So I'm not, I just wanted to make sure everyone understood the difference between what our responsibility is and the county and the state. Okay. So these are different ways that you can apply. You can, if you feel savvy enough to go online, you could do it online with NewJerseyFamilyCare.org, or you can call the 1-800 number that you see listed here. They have all languages available to assist so that there's no barriers. You can also go to the County Board of Social Services. And this sometimes I recommend, especially for the individuals that have very low income or no income at all, because there's other resources available for you, such as food stamps or welfare or many other resources to help you. Okay. And then, of course, there's Horizon NJ Health that you could reach out and one of the representatives can assist you as well. Okay. So when you get your ID card, this is what the ID card looks like. Okay. Just to give you an idea. And this is our Horizon ID card. Your name should be on there. Your primary care physician should be on there. You have the right to choose your primary care physician. Very, very important. I'm not sure if you guys were aware of that, but you do have the right to choose your primary care physician. So if the time of the application, you selected a primary care and you got your ID card and that primary care is not on your card, all you would have to do is turn that card over, call member services and let them know that is not the provider that you chose. You would like to select the one that you wish. They'll make that change effective. It'll be effective if you need it that very day because you're at the doctor's office. They can make it effective immediately. Just have to let them know. If not, it'll just be changed the next day and you'll get your new card within 7 to 10 business days. Okay. The other thing I wanted to specify is when you do apply, the process does take 45 days. Very, very important. Be on the lookout before that. You're going to receive something in the mail, either from the County Board of Social Services or New Jersey Family Care. Okay. Be very careful. I'm guilty of throwing mail in the trash when I think it's junk mail. Look through it very carefully because it could be this letter. It's a list of documents that they need in order to process the application. It also comes with a self-addressed envelope with a stamp that you could just send it right back. The sooner you send it back, the better. The application will continue to process and you'll get your coverage. Okay, so please be careful. And then one more thing I wanted to stress, If you do have coverage with whatever HMO, it doesn't matter, please remember to renew your coverage. Some of you may have to do it 6 months. Some of you may have to do it every year. You will normally get something in the mail letting you know. If you feel that you got it and accidentally threw it in the trash, no fear. You can actually call New Jersey Family Care and find out what that date is, or even do it over the phone. Okay. Or you can speak to one of us and we would be more than willing to assist you. Very, very, very important. Okay. Do I still have time? I'm not sure how much time I have.
You do. You have until 11:22-ish.
Okay, perfect. So these are just some words that we wanted to share with you, words that you should know. A member is a person that is enrolled with Horizon NJ Health. Premiums, those of you that used to pay a premium during the pandemic, the government stopped it. So there's no longer premiums being collected. Or if there are co-payments, that would be on your card. As I showed you earlier, you'll see it on the right-hand side in the front of your card. Specialists, these are different doctors that, provide services in all different areas. And these are just some examples: cardiologists, the OBGYN, and here you have the ophthalmologist who treats for eye problems. So you have coverage for all of that. And here are some additional words: urgent care facility. You heard me mention prior authorization. Okay. And this is your doctor's responsibility to get for you should you need any kind of medical treatment or, any procedures done. Prescriptions is something that the doctor gives you so that you can get your medication needed. And then the formulary is a list of our prescriptions that are covered under Horizon NJ Health. Okay. So our provider network, very important. If you do go to any of our providers, they have to be within network. You do not have out-of-network benefits. Okay. If you need help finding providers, there's several options that you can do it. You can call the number in the back of your ID card, or you can go online to our Horizon NJ Health website. We just updated it. It looks amazing. I encourage you to go and check it out. And the other great news that I wanted to share with you is that our Medicaid app is available now mobile. So you're on there, you'll get your digital ID card. You'll be able to change your PCP. So there'll be more information regarding that Medicaid app. It should be coming in the mail to you, but if you would like to learn more about it, please do not hesitate to call the number in the back of your card. A representative will be more than happy to share that information with you. So if you go to your primary care physician, they do, would like for you to go and get your lab work done. I know that sometimes it could be a barrier. Transportation is an issue, or you just don't have the time because you work. But we want to let you know how important it is for you to go to get your lab work done. This just helps the doctor determine if there's any kind of issues. Maybe there isn't, and that's great. It's a blessing. But if there is, they can catch it ahead of time. And just to let you know, LabCorp is the lab that we work with. And just as I mentioned, if there are any barriers in regards to transportation, we do have Movicare available. As you can see here, the phone number is listed. Please feel free to jot that down. This is available for our Horizon NJ Health members. My advice, if you do need the transportation, please make that appointment 2 days prior to your doctor's appointment. So that way everything goes nice and smooth. Try not to wait the day of, because it could be almost impossible for you to get it. Okay. So they'll take you to your provider's appointment and even pick you up. Okay. And again, if you want any additional information in regards to Movicare, please jot down that number that you see there. A representative there will help you and answer any questions. And again, you can always call member services on the back of the Horizon NJ Health card. All right. Okay, and these are some really, really important numbers that I wanted to share. We have our member services number that you hear me mention quite a bit. We have our Horizon NJ Health enrollment hotline. This is if you want to speak to someone and just try to get an idea if you're eligible or not. A representative there will help guide you and then do a nice smooth transfer to New Jersey Family Care to help you get connected to a representative that will help you. We also have a really great case management department. These are our nurses that are licensed to assist any individual that is in need of additional care. They're having an issue navigating the healthcare system, and these nurses are here to help make those, any kind of stress. They're trying to smooth that out for you and get you connected so that you can get the care that you need. If you feel that you can take advantage of this, I would totally encourage you to give this number a call. They will call you and talk to you over the phone and just try to get an idea of how how more or less they can help you. But I definitely encourage you to just give them a call, even if it's, I got a prescription and I don't even understand what I have to take it for, or I'm having a really difficult time with a specialist. Can you help me, connect to a specialist? Or I don't have enough money to pay my electricity bill, or I just got kicked out of where I was living. All their job is to pretty much help relieve the stress so that you can focus more on your health. Okay, so totally take advantage, give them a call. They're there to help. We have a 24/7 hour nurse line, a nurse available to answer any questions that you may have. And the list goes on and on. And if you need this, I can make a copy and send it and share it with anyone who's a Horizon NJ Health member. Just let me know, and I'm sure I can email it to Frankie and get it to you. Okay, so I'm going to stop here. And, because of time, give anybody a chance to answer any questions or ask any questions, excuse me, and I can answer them. Don't be shy.
Thank you so much, Darlene and Evelyn. We have a question from Pam King. Pam, I'll ask you to unmute.
How do you sign up for the Modi, the formerly the district scale? Because we were trying to sign up for it when I was doing physical therapy, or if I go to the doctor's appointment. So how do you sign up for it and to get started with it?
Okay, so if you are a Horizon NJ Health member,
I am.
okay, then all you would have to do is call that number that I have there. Let me go back. And I could get, like I said, I could get this to Frankie, and Frankie can share.
Can you do that for me?
Yes, I'll share this with
Okay, thank you.
And Frankie, I hope that's okay. And we'll get this to you. And all you would have to do is call that number, and they will help you. Okay.
All right, thank you.
You're so welcome.
I put the Modvicare number and the TTY number in the chat for anyone who wants it.
Wonderful. Thank you so much.
Thanks, Pam. Great question. And yes, as Erin said, the contact information for Modvicare is in the chat right now. So we hope that is helpful to you. And I do see James, you have your hand up as well. So we are going to prompt you to unmute. And again, we don't want to get super personal about the questions today. We're so happy Darlene and Evelyn are here to discuss, general services. So please don't reveal any personal medical information in our questions. Okay, James, go for it.
All right. Let's see here. So why can't other non-NJ people accept this? Why is it not compatible with certain places? Why can't they just, kind of take it? Why?
Okay, you're referring to providers, doctors' offices?
Yeah.
Okay. So what we do is we have our credentialing department that will reach out to any provider who would be interested. We do try to get as much specialists in as possible. So if there are any doctors that you are aware of that would be interested in joining our network, we would love to have them. Just let us know and we'll have our provider network reach out and get them on.
Excellent. Thank you so much for that question, James. And thank you for your response, Evelyn. We have reached the end of this part of the exhibitor hall. So again, thank you so much, Darlene and Evelyn, for being here to represent Horizon NJ Health. We truly appreciate it.
And Ashley, I wanted to say, I'm so sorry, I missed my cue to say good morning, but I am fairly new to Horizon New Jersey Health, and this is my first luncheon, but it has been really just glad to be here. And congratulations to everybody receiving an award today. It's just nice to hear all the wonderful things that are happening.
Yes, absolutely. We're so happy you could be here. Thank you both again. And we will now be spotlighting Tara Coley. Tara Coley from Prism Support Services. Hi, Tara. Thank you so much for joining us.
So I'm just going to do a quick presentation just on, I'm sure many of you guys already understand about DDD services, but I'll just give a quick presentation about DDD services and how Prism fits into that. So just quickly, the supports program and the care community care program, it was developed by the New Jersey Department of Human Services, Division of Developmental Disabilities, also known as DDD. It's a public funding source for certain services that will assist eligible New Jersey residents with the intellectual and/or developmental disabilities who are at least the age of 21 or older to help them live independently as possible in their home or in the community. So who are we? We're a support coordination agency. We pretty much provide care management. We assist individuals and their families connect to appropriate DDD services, as well as other services that involve medical, social, or educational needs. We've been in the healthcare field for over 15 years. We serve all counties in New Jersey except for Cape May, Salem, and Cumberland. We have about 20 support coordinators on staff. And the good thing about our agency is that we approve our own plans, which means that services start faster instead of there being like a delay waiting for DDD to approve the plan. So just a quick program eligibility overview, which many of you probably are already aware. So in order to be eligible, you have to meet the criteria, which is to be a New Jersey resident. You have to be at least 21 years or older. And you must be eligible to receive services from DDD, as well as be eligible for Medicaid. Once you meet that criteria, then you would be, you'll submit an intake application to your local DDD county office in your county. Once that eligibility is met, then you'll complete an NJ comprehensive assessment form, which is over here. So what is it? It's an assessment that determines an individual's eligibility tier to receive DDD funded services. So what is assessed? Things like cognitive abilities, such as they ask questions like, can the person remember events that occurred a month or more ago? It asks about self-care and independent living skills. Can they feed themselves? Can they make a simple meal? As well as verbal communication, special behaviors, or any type of medical issues. That is asked in the assessment as well. Let me see. So who completes it? The informant should be someone who really knows the individual. So it can actually be the individual themselves, because some individuals don't have any family to be able to complete the assessment for them, but they can complete it themselves. It could be a guardian, a family member, or just like a staff that has worked with them for so long and they really know the individual very well. It can be completed online, by telephone, or in person. After the assessment is completed, the results are summarized into a score based on 3 main levels, which is self-care, behavior, and medical. And the score ranges from 1 to 4. The individual is then assigned a tier level. So it could be an A, a BA, which would mean it's an acuity, and that's just based on the individual needs. Each tier is assigned a budget that includes an employment day support component, as well as an individual and family supports component. After that, the individual, once they're assigned a tier in the budget, they are going to complete a support coordination agency selection form. On that form, they can put the most 2 support coordination agencies of their choice. If they don't know any type of agency or agency that they want, they can elect for DDD to assign them to one. Once they've been assigned a support coordinator, the support coordinator will then contact the individual and their guardian or family member to schedule an intake meeting. At that meeting, the support coordinator goes over the NJCAT assessment, again, just to make sure that the individual needs is actually correct. And if there's anything that needs to be reworded, corrected, then that can be done when we develop their individual service plan. We also do the person-centered plan tool, which is really much to get to know the individual. It's asking them what are their goals, long-term, short-term, what are things that they like, the things that they dislike, things like that. So we can really get to know and make sure that their plan reflects that and also reflects the services that they will be going for. So some of the services that are available, they can use it for assistive technology. For example, if someone is non-vocal and they communicate through an iPad, there's a process where they can go and use their budget to pay for the iPad. They also have services such as community-based supports, which is popular. I know for our agency, a lot of individuals, they want to increase their social skills in the community. So they have a staff come and take them out in the community to do various activities. Some people use it for occupational therapy to improve their motor skills. Some people use it for transportation, whether it is to have an agency that come and transport them to and from work or for school or day program, or some individual use it to go run errands in the community. They use it for Lyft and Uber, or they can use it for a gym membership. So it's various ways that an individual can use their budget to pay for services. So here's an example of the tier assignment and budgets. You see there's tier levels A through EA. The acuity, you'll see an A after a capital letter. That's just an acuity, whether it's based on a medical need or a behavioral need. And as you can see, you have an employment day supports part of the budget, and also an individual family supports part of the budget. And then supported employment, and that's available as needed. And that's an example of a supports program, someone that's assigned to a supports program. And then for a tier assignment and budget for a community care program, it's the same as a supports program, except for you have an additional budget, as you can see on the 4th column, where it says individual supports provided residentially. And that funding is used for residential, or if they live in a home and they need additional supports, that budget can be used to support that. I just want to give just a couple examples of how individuals can use their budget. For example, we have Noah, who's part of the supports program. He's a tier A. He uses the services pre-vocational training to develop skills to obtain a job. He also uses his budget for community inclusion, which is to be a part of a group. And he's trying to use that to improve his social skills in the community. And he also attends a camp. And so he uses his budget to pay for camp, and that will fall under respite. And his budget total that he utilizes so far is $7,000, and his total budget is $23,000. So that means he has additional money if he want to increase services or add additional services throughout his plan year. Another example is Angela. She's part of the supports programs. Her tier level is a B. She uses the goods and service part of her budget to pay for college courses. And she also uses it to get to and from school, so she uses Uber. So her budget has been approved to pay for that. She also uses the service community-based supports because, as well as Noah, she wants to increase her social skills in the community, and that's more of a one-to-one base with the staff. And the last example is Maria. She's part of the community care program, and her tier level is an EA. As you can see, she uses 3 services in her budget. The first one is to pay for her group home, which falls under individual supports. She also utilizes it for her day program, and she also receives occupational therapy, and that's to improve her motor skills. She uses majority of her budget, but she still has money left over. Again, just like Noah and Angela, if she wants to increase services or add additional services, she can utilize her budget for that. And also, I want to just highlight that also our staff, we don't just only do things like that. We have situations where a caregiver has a medical emergency and an individual needs a residential placement right then and there, and we will reach out to DD and help them get some type of residential replacement. That has happened, and that's what we're here for as well. So if you have any questions, I know it went pretty fast because it's a brief presentation, but I mean, you can ask it now, or you can contact us at info@prismsupportservices.com, or you can call us at 609-498-7760. Thank you.
Thank you, Tara. I am going to ask if anybody has questions or feedback that they'd like to share. We have a few minutes. You can raise your hand or even type questions in the chat. It was very informative. I think those examples at the end were especially helpful.
Thank you.
Okay, let me see. Does anybody have questions? Ellen, I see your hand up. Again, I'll just a blanket reminder, let's not get personal. We are just asking more general questions about the services provided by Prism Support. Go for it, Ellen.
Hi there.
Hi.
Thank you so much for coming on.
Thank you.
The thing about oh God, what was it? The thing about the different tiers that you were talking about.
Yes.
I'd like to know more about the tier for community-based and home
Home supports.
that you were talking about, the different ways you can use them?
Oh, community-based supports to work in a home. So tier level is just based on what the score is from the NJCAT. So it doesn't matter necessarily what tier level you are in, your budget will help pay for that, but we just have to monitor making sure that you have enough money to support the number of hours you want. So examples of community-based support, some individuals use it, some staff come in a home, help them with learning how to meal prep, with cleaning up their home, whether it's going out in the community, going shopping, managing money. There's different ways you can utilize the community-based supports, and it's really more specific to the individual. So if you have a particular goal that you want to work on, when we set you up with staff and you meet with them and you say, these are what I want to work on, and then you can see if that staff can work well with you into meeting your goals. I hope that answered. I'm not sure if that answers your question a little bit.
Thank you for that, Tara. So next we will be joined by Derrick from Blue Light Music Program. So Derrick, thank you, and I'll turn it over to you.
Hello, everybody. Thank you. My name is Derrick, and I am with the Blue Light Music Program, and I'm joined here today by my colleague, Nick Avellino, who is also an instructor for our music program. Thank you for allowing us to attend. It's really been inspiring to hear, everybody's experience with self-advocacy. Thank you for sharing your information and for inviting us to share our information with everyone here today. It's an honor to present before all the self-advocates here today and all those who directly support the mission of self-advocacy as well. I think a key component of self-advocacy is recognizing the importance and the power of the sound of your own voice, however you're able to express that. We believe that one of the most important aspects of music is its ability to build the strength of that voice, to communicate when doing so is a challenge, and to bring people together through the music that they share. So thanks again for inviting us. And we're going to have some fun things after I'm done talking, which Nick is going to provide. So just a brief history about us and an overview of the service that we provide. The Blue Light Music Program was introduced in 2009, and to date, we've served hundreds of individuals across New Jersey. The music program is an inclusive music program for youth and adults, both typically developed and of all abilities. Music program classes are hosted in one of our 3 studio locations: in Trenton, serving Mercer County, in Mount Holly, serving Burlington County, or in Blackwood, serving Camden County and Gloucester counties. Music program classes are also hosted online, which enables us to connect with students across New Jersey. So whether you're at the very north part of the state or the very south part of the state, you can still participate in our music program. Today, my colleague Nick is going to provide a demonstration of the types of activities you might participate in during a virtual program. Youth and adult group sessions are 90 minutes in duration and capped at 6 students with 3 instructors, which means that there's a very low student to instructor ratio so that everyone can get a chance to work directly with one of our instructors. All of our instructors are musicians and audio engineers who are experienced and skilled at providing support and accessibility to participants of all abilities. Private one-on-one sessions are offered virtually. While you're attending, students can participate in a variety of activities, including instrument instruction, songwriting, group collaborations, recording their voices, singing, music production, and beat making, lessons in utilizing recording software and technology. Truly, whatever your musical ambitions are, our instructor's job is to help you realize that. As far as enrollment goes, youth enrollment is exclusive to our youth partnership agencies and organizations. Most commonly, the method for youth enrollment is through the Youth's County CMO. We do not accept private pay for youth. Inclusive services for developmentally disabled adults are available through the Division of Developmental Disabilities, Goods and Services component of an individual's ISP. So following the Prism presentation, Prism would be able to help you utilize your budget in order to come and participate in one of our music programs. We also accept private pay for adults. A button for our enrollment form will be found right on the front of our website, which is www.bluelightmusicprogram.com. And we'll also drop some more information in the chat that you can follow after our presentation. And now it's time for exciting and fun stuff. So I'm going to turn it over to Nick because he gets to do all of the cool stuff. Take it away, Nick.
Awesome. Thank you, Derrick. And thank you everyone for joining us today. So we're going to show you what a session could look like. Start your video. I have two instances of myself that just enables me to do what we do. So I will share my screen here in a second. Typically a session, to stem off of what Derrick was saying, could look a lot of different ways depending on the student. Our service is predicated on the interest of the individual. So the instructors are there to guide them in the process of developing their musicality around what they're interested in. So a session might look like creating a song together, writing lyrics together, and taking their emotion and how they feel about their life experience and converting it into something productive through the channel of music. And again, that looks very different with a lot of individuals. So we really pride ourselves on being able to accommodate everyone's different level of musicality. So today we're going to make a little song right from beginning to end and show you what that might look like. So now I'm going to share my screen. Okay, can everyone see that? Awesome, thank you. So we use, all of our instructors use an array of different musical tools to be able to host a session right online, just like we're doing in a Zoom call, and create a really cool song. So on the left of your screen here, this is called a digital audio workstation. This enables us to create music, organize it, arrange it, and just craft the song how we want to. Add really cool effects right on call, and we will get to that in a second. And to the right here, this is called Splice. Our instructors use a hub of well-recorded professional sounds that we can use and collaborate with our students to create some really professional songs that you would hear on the radio. So I'll just scroll through a couple sounds, and for the sake of time, I'll just explain that this is typically how a session would go. We'll kind of just show you what it would look like engaging with a student rather than engaging with anyone on the call. But again, this is, can everyone hear that? Yeah, okay. So that's a cool flute sound. And we would go through and audition different sounds with the student and ask them, hey, do you like this sound? Or do you like A sound or B sound or C? We'll just scroll through a couple different ones. Lots of cool stuff. So let's make a song together. So I would ask the student, hey, do you want to make a pop song, a country song, a hip hop song? And they might say a pop song. So we would look up potentially a loop to get us started. That's pretty cool. So they would say, yeah, I love that sound. Let's use that. And we would pull it right into our digital audio workstation, just like that. And during the process of us creating a song, we would also teach them and give them, you know, technical information that they might use, you know, if they're trying to pursue music themselves. We have a lot of students that are producers, engineers, artists in their own right. So we want to give them the tools to be able to, you know, further their purpose outside of our program. So with this loop, it comes with information. I would explain to them that the tempo of a sample and the key is how we arrange music to make it sound good. So we will change our tempo in our project to 115, because that says it right here. And that's going to organize it for us and set us up for success in the future. And it's also in A minor. So we'll make a little note there that our song is in A minor. And now it's in our project, and we can play it and hear it coming from our digital audio workstation. And we can add stacks and layers and different parts to complement our song. So from there, maybe we would get a kick sound and build out the rhythm of the song. And we would scroll through again, come up with different kick sounds. Ooh, they would like that sound. Cool, let's pull that in. And we would build a little rhythm together. Again, completely engaging them the entire time. They're the creative director of this. We're just here to guide them. We'll just do something really quick and see how that sounds with our loop. Cool. I like it so far. Let's get a snare and keep building it. This will be that one's cool. Let's get that in there. And we got a little drum groove going on. Again, completely engaging the student the entire time. Now let's hear what we have. Now that I'm hearing it, I just want to add one little thing. This one's for me. Just put that there. Yeah, that's a cool groove. All right. And the coolest thing about this, and my favorite part personally, is these sounds are cool, you know? They sound like something you might hear in a song. But again, our service is completely predicated on engaging the student and making them feel like they're the creative director, because they are. And they have a voice, like Derrick was saying, and they have good ideas. That's what all this is about. So the cool thing about this is we can record right over the call. So if a student or individual has an instrument at home, that's always incorporated in the song. It's the priority. If they just have their two hands, which everyone has, right? And they clap, we can add that into the song. So I'd like to ask Derrick, my colleague here, to assist me in demonstrating that and giving me a clap to show you how easy we can record. So I'm gonna hit the record button. There we go. We got one. So let's hear how that sounds. Sounds like a clap. Cool. Let's make it a little louder. Yeah, there's a setting in Zoom that makes loud noises quiet.
And I see one of our hosts, Miss Ashley Ritchie, has a violin behind her.
Oh,
so
very nice.
There must be some music in her background. Ashley, would you mind giving us a hey? Maybe we could record your voice along with it.
Evelyn, would you like to do that?
Evelyn.
That would be
Evelyn,
cool.
where are you at?
I'm here. Hey,
Evelyn, would you like to contribute hey to the song?
sure.
Okay,
Well,
Nick, let Evelyn know whenever you're ready to record.
You are rocking and rolling. Just say hey.
hey,
Beautiful. I love it. Everyone has such a unique voice. Let's hear it.
hey.
Just like that. Now, the cool thing is that sounds like a Zoom call, right? But we can make it sound awesome with crazy effects, like this effect, for example, called reverb.
Hey. Wow.
Pretty cool. We can also add something called a delay, which I'm sure everyone has heard before, right? When you go in a cave, you go, echo. Let's hear how that sounds on our hey.
Echo.
So pretty cool. Let's throw that into our song because, again, we're creating original music here and see how it kind of like complements the flavor of everything. So we'll take our hey. I'm thinking right in the beginning.
Okay.
Okay, boom. All right, let's hear it. Nice. So as you can see, we could do pretty much anything. Our imagination is our only limit here, which is limitless. So that pretty much concludes my presentation. I'm going to hand it back over to Derrick and we can take any questions. If anyone has any questions about the services we provide or how to reach us. I'm sharing my screen as well.
Thank you so much, Nick and Derrick.
Thank you.
That was super fun. Yeah, does anybody have questions, comments, feedback about this? Pop your hands up. I see Adam. Adam, what would you like to say?
Hi, drum.
We have a lot of drum students, and we can do that in studio if you're near one of our studios, or we can do that online as well.
I've been drum every birthday.
I love playing drums.
Drums is my favorite.
Awesome, Adam. We would love to have you guys get involved with some of our virtual programming. This would be so fun to make some music as a group. Simon, you are a frequent attendee of our virtual programming. What would you like to say? Okay, there we go.
You know how to make a song and you do on a computer to so the record to on the CD.
Yeah, absolutely. So typically at the end of the session, we will always give a tangible product to the student, whether that be a CD, an email of your file. And the cool thing about using all these sounds through Splice and original sounds is that it's 100% royalty free, meaning if Beyonce reached out to you and wanted to buy your song, it's completely all yours. Just remember, my name is Nick. I was your instructor today.
Awesome.
Does that
Thank you
answer
for
your
that.
question?
Yeah, you got a thumbs up from Simon. Awesome. Evelyn, you have a question as well. Go for it.
Yes, I sing at the talent show every year in November, I believe. And what we have is a music instructor. We have an electric piano, and she teaches me how to sing from that. So it's beneficial, good, but the background we use also the original music.
Very nice. Yeah, you could totally use your own original music that you make in the program.
Thank
Very
you.
cool. Yeah, thank you both. James, I will ask you to unmute. You will be our final question of the Exhibitor Hall.
All right. So you create music, right? Well, I play guitar.
Nice.
And I'm learning music and I'm getting pretty good at it. I've gotten to a point now where I can play chords and read sheet music very efficiently.
Nice.
Do you play an instrument yourself, or, you know?
Yeah,
I
that's
play-
a great question. So all of our instructors are musicians, engineers, producers in their own right, and they have the ability to be able to give a base level theory lesson on any instrument to help you get better in your own pursuits. So you mentioned the guitar. All of our instructors would be able to help you learn more chords and get better at strumming and just build you up as a musician.
Very cool. Well, again, Derrick and Nick, thank you so much for being here today and sharing information about Blue Light Music Program. We
Thank
really
you for having
appreciate it.
us. Thank you so much.
Yeah,
Thank you, guys.
thanks so much.